is Petra, and I am 50 years old. I had my 50th birthday here in Salt Lake City while seeing Dr. Bingham and for Calmare Therapy. I have RSD, and I am being treated. This is my last treatment probably though, because I do not have any pain any longer. I came in, my pain level was a very consistent 7, and now I am virtually pain-free. So I came out on Mother's Day with the blessing of my daughters and my husband, and I came out here. It's been a long 3 weeks. It's May 31st today, and he's going to tell you about everything I've gone through, or we've gone through.
Petra had total knee replacement surgery on December 3rd, 2012, and as a result of her surgery, she developed RSD or CRPS. Through the process, it took approximately a month and a half before she received a diagnosis through a bone scan that she actually had RSD. But in the meantime, we saw multiple doctors. Nobody could really figure out what was going on. We did see a pain specialist, did some sympathetic nerve blocks. The first time we met with the pain specialist, they said, well, you're going to need a spinal stimulator. Being holistic in the way we look at things, that was unacceptable. So we started scouring the internet, trying to figure out what to do for her while she was maintaining on these medications. We stumbled across hyperbaric oxygen therapy. She did approximately 40 sessions of that, had some good results, not great, but it helped. And then about 4 weeks ago, we stumbled across Calmare Therapy and figured we'd give it a shot. We looked there, and there's places all over the country, but we wanted something locally or close enough to us, so we settled into Pleasant Grove here outside of Salt Lake City with Dr. Bingham. And as a result, I'm happy to say that my wife is 100 times better than she was, maybe 1,000 times. This is a condition that I can't even fathom, but living with it and living with her, it's just been, it's amazing how our life just changed in an instant. But this Calmare Therapy has given her life back, and she's the woman that I fell in love with and I married, and I'm happy for her at this point.
It's been a long 6 months, and I don't remember all of it because I was on a lot of medication, which I'm not on any medication any longer. And so he was my primary, caregiver and the kids' caregiver, and now I can go back and be a mom and a wife and have a life. So I'm really excited.
So what medications were you on for your RSD?
So I started out with oxycodone, and I was popping them like crazy. That wasn't doing anything. I felt like a drug addict. I was off of those, and I went on steroids, Lyrica, gabapentin, hydrocodone, Restoril, which is a sleeping medication, naproxen.
And the drugs, when she was on the medication, the gabapentin, the hardest thing for me was when my wife said to me, I feel like killing myself. She had her knee replaced. She had a total knee replacement, and a month and a half later, I got a woman that wants to kill herself. That's not an option as far as we're concerned. And it was, in my opinion, due to the medication. And the pain, of course, the pain is huge, but it's been nothing. She was just standing here dancing. That's amazing to me. That's, like I said before, that's my wife. That's the woman I married. She's a happy-go-lucky person, and it's nice to have her back.
Okay, Petra.